We are back again.
Yeah, and not only did you invite me back, but you let me be host for this episode.
We'll see. I gave, yes, you have the reins. I am your sleigh horse, something like
Yes.
that. So be nice, be
Yeah.
gentle. Tell me where to go, and I'll go where you take me.
Right. So,
And
we're coming up on, obviously, your anniversary, right? With Gwen. Okay.
yes, of course I do.
And so, but you also have another very important anniversary coming up. So I'm hoping you can kind of dive into what that is and what that means.
Yeah, and that is for the we'll solve the mystery for our listeners. So it's Advent's 20th anniversary coming up on, what is the date? Do you know?
No. Oh, but you
Oh
are going to tell me.
man.
Well, I only do it for the day
Advent.
that I joined, and so that's my anniversary date.
What was the day that you joined? What was the date?
So would have been July. Yeah,
Yeah.
I'll have
See,
to check on that one.
this is not a good
Oh,
showing. But anyway, what is your actual wedding
what's
anniversary?
mine? Yeah,
Yeah.
it's June 17th, 2011.
You
I'm
sure about that?
positive. Yeah.
Okay. All
Yeah.
right. Okay. So Advent was born on November 1st, 2004. So yeah, we're coming up on 20 years, not too far into the future. So yeah, which is, I don't know, uh, it's a
It's a
long
long
time.
time. And obviously, when
Yeah.
you started, where you're at today was always in the cards, correct? You,
Well, when we started, I intended to be alive 20 years from when we started, but I had no guarantees. So, that's true. I think I had, and that, when I say it wasn't just Gwen, my wife, who is an audiologist, so we founded the practice together, and no grand plans. I mean, literally, the plan was we had been with a different practice for well since July of 2003, and it just things weren't going the direction that we wanted them to go, and so we just knew that we had to do something, which it was going to be a start of practice, and so we literally, I don't know, went out on a limb and decided to kind of do this thing. And all we were trying to do at the beginning was just simply be the best ENT practice around. And we were, humbly speaking, the best ENT practice around for a good era, which was good. I mean, it was great. Meaning that and when I say that, I mean it means we had one office in Wauwatosa, Wisconsin. That this is, I mean, when we started, we literally had half of an employee, not half of a person, but part-time
right.
person who worked somewhere else and just gave us some hours. So we literally had nothing. She eventually came on as a full-time employee, so we had a full person, a full body there to help us, and then we kind of grew just person by person, not too big. I mean, we were sort of solo ENT office for a decade. So if we've been here for 20 years, the first 10 years was one doc, and you're looking at them, and yeah, but things have changed quite a bit since then.
Right. And so just circling back, what does it mean to you? What did it mean to you? And does it mean to you to be the best ENT practice you can be? How do you define that?
To me, it meant results more than anything. And in that era, when we first started, all of our patients were coming to us by referral. So they're coming, primary care docs mainly in the community would send patients to us. And that was a big deal. It still is a big deal. Anytime anybody trusts me and trusts my organization to take care of themselves or somebody they're sending our way, it's a big deal. And so when I was serving our patients, when Gwen and I were serving our patients, we were serving the patients that were in front of us, but we were also serving the docs who were referring those patients to us, because basically if we took good care of the patients that they sent to us, they were likely to send us more. And if we took bad care of those patients, they were unlikely to send us more. So to me, the best ENT practice around was taking the best care of each individual patient that was there in front of us. And yeah, and I mean, nothing's changed to this day. I think for me, coming out of residency, I'm thankful for both where I trained, which was University of Oklahoma, and how they trained us, which is they trained us to be self-sufficient, results-driven, process-driven. Everything I am today as a surgeon, I owe to kind of that training program and that mindset. So I came into this Milwaukee world with a mindset of I'm here to deliver results, and yeah, that was the definition of success. And I feel like mission accomplished in those early years, meaning we were able to do things that others weren't. To kind of kind of come off of the Jerry Rice quote, because I feel like I had a mindset and focus that others didn't, honestly, at the beginning. And Gwen did too, for her part of things from the audiology side. So, yeah.
So, little sidebar, but how did you come up with the name Advent or Advanced Ear, Nose, and Throat?
Yeah, I mean, it was so how we came up with the name. This very specific reasons for those who want to take the time machine back to 2003, 2004. What was more important than Dr. Google was the Yellow Pages. And so the practice that we left, the name of that practice was Affiliated ENT. And the Yellow Pages being at the top of the Yellow Pages was really important. And so when I named this practice, I didn't want to name it my name because I didn't know what we were going to do exactly, but I wanted to keep open the possibility that this thing would be bigger than just me, if that made sense, and Gwen. And so it basically made it that the name of this practice was going to start with an A, so it could be at the front of the phone book, and the second letter was going to be a letter in the alphabet before the letter F, so we could be ahead of the practice that we just left. And that's worked out really well. And it wasn't really like a grudge. It was more of a I want to be at the top of the Yellow Pages listing. So when people open up to ENT, they're going to see Advent first. And the name Advent, I literally remember it was late at night. I'd seen patients and we did our notes, and my attorney, we had to set up a corporation. And he's like, I need a name for this corporation. And I'm like, I'll get back to you. And then Gwen and I were kind of trying to think things through. And that's where the name Advent came in my head. I'm like, okay, it's advanced. I can't remember. There were some other advanced things, and I was like, advanced. I think I came up with Advent, and then meaning that I knew it was going to be ENT, something ENT, and it was like, what ENT? And then we got to get in the Yellow Pages, and then it sort of came together as Advent. What about that? And then we just rolled with it. So and still to this day, I take glee in the fact that if I'm presenting at conferences, other things where other businesses are, we almost always are at the top of whatever that is. And I'm like, 20 years running, nobody's stopping us from owning the top of the alphabet.
Right.
So except for, I think there's going to be what is it? Does Aardvark start with two A's? There's going to be some ENT that's going to trump us on the.
I'm literally the worst speller, so don't answer me that question. So anyway. even back then had some good business intuition as far as didn't know exactly how it was going to play out, but got to the top of Yellow Pages. So next question really is we'll touch on in a second where you think the next 10 years will go, or 20 years, I should say, but. When you're looking back in time, what do you think were kind of the three, if you had to distill this down, kind of three lessons that you learned or practices that you deployed to get where we are today? Because when you think about the evolution of Advent over 20 years, it's massively different than when you started. And there's been different growth phases and evolutions, but I'd be curious to hear what you think were kind of the key takeaways for you.
I don't know. We'll see if I come up with an exact number three things, but I'd say unrelenting focus on the patient that is sitting in front of me when it was just me has translated over maybe a little less intensely at this point to you guys having a singular focus. That honestly, that the one thing that has made Advent what Advent is is that everything that we do, every way that we do it, has been molded around the patients that we're trying to serve, which sounds like, oh, that's not that special. It's profoundly special, because over those same 20 years, what's happened is that healthcare as we know it in this country has mutated away from individual patients. Meaning that at Advent, what are we known for? We're known for things like in-office CT, in-office turbinate reduction, which is just a simple way to help somebody breathe better through their nose, balloon sinuplasty, which is a simple way to get the sinuses open, oral appliance therapy, which is a simple way to treat sleep apnea. So on and on and on. I'd say, well, like each of these things have existed for a relatively long time. Many of them were sort of discovered over the course of those 20 years. But what we've done as a practice in our space is, as these advances, like as I'll use in-office CT as a specific example, when I saw that and understood it, I knew that my patients deserved that, meaning the alternative to an in-office CT scanner is a conventional high-dose radiation CT scanner in a hospital setting. And so one of the obstacles in the way of patients that I was trying to treat was, it was hard to get imaging for them. If I need to evaluate somebody's sinuses, I need to have a CT. In order to get a CT, I got to send them out of my office to a hospital or imaging center. They've got to have it done. At that point, they actually had to print the films off.
Wow, you really are.
Go back, get the films, or this is like right in the era where they're starting to burn discs. But still, it was a big pain for them, and it meant that what ended up happening is I would send people out, and it was the hassle factor was so high that a lot of folks were like, I'll just deal with it. And so I was like, we have to do this. And so 2007, we installed our first CT scanner. I think it was the first one in Wisconsin. It still remains. I mean, anyway, just using that as an example of, for us, it was like no brainer. We have to do that. And yet for, sort of other ENT practices and hospital systems, to this day, they don't have in-office imaging, not because it's not the best thing for their patients. It's because what's ended up happening over the last 20 years is physicians have, this sounds harsh, but I'll say it anyway, have relatively speaking turned their backs on their patients, and who they're serving tends to be hospitals more than patients. And hospitals are not really in the business of serving patients. They're more in the business of making sure that they exist and they get bigger. So I know it's harsh, and you didn't ask the question to get that harsh answer, but it's true. At the end of the day, everything that you see at Advent, everything we have at Advent is we do things in the manner that I would want them done unto me. If I had nose and sinus problems, I would want access to in-office imaging. I would want access to office-based nose treatments. I would want access to balloon sinuplasty. If I had sleep apnea, I would want access to oral appliance therapy. If I had allergy issues, which I do, I would want access to allergy drops and or allergy shots. You know what I'm saying? So it's like all of these things are very simple, but all of these things are really, for the most part, impossible for people to get unless they have an Advent in their community, which is that's been the thing that's led to our growth. Is we've got to get these. We need to expand access to the simple solutions that exist. And what I thought was going to happen 20 years ago or 15 years ago was the things that I was doing back then. It was just going to be, yes, I know I'm leading edge, but hey, I'm doing this in 2006. Everybody else will catch up in 2010. But what's happened is, hey, I'm doing this in 2006, waiting for people to catch up, waiting. Nothing's happening. And in fact, I really do feel like for us as a specialty, ENT, it's actually we've almost gone backwards over the last 10 years from where we should have gone, meaning the natural moves that we've made at Advent are moves that we should have made it as a specialty. But for a variety of reasons, our colleagues, unfortunately, are sort of stuck in the past and moving backwards, which means that there's almost even a greater dichotomy but between what we're doing at Advent versus sort of more traditional ENT.
And so just to kind of clarify what you mean by going backwards or not moving forwards is the move to take things that were traditionally done in an operating room and do them in an office setting, and specifically at Advent under local anesthetic, right? So there are things that we do every day in an office that are done in an operating room, but can be done in an office.
Yeah, exactly. No, exactly. That's a good clarifying point. Exactly. And though, just again, to be even more specific and clear, there's no dispute about, none of our colleagues would dispute the fact that this, like the turbinate reduction as a specific example. This is when we help to allow somebody to breathe. A turbinate reduction, how long does it take you after somebody's numbed up? How long does it take you to do a typical turbinate reduction in the office?
I mean, the way we do it, 8 minutes.
Yeah, so like 10 minutes. Those 10 minutes change lives profoundly, no doubt about it. Outside of Advent's walls, what percentage of turbinate reductions are done in an office setting in this country? And I'd say, here's my choices. I'll give you a multiple choice. A, 1%. Well, I'll just stick with A. A, 1%. B, less than 1%. C, greater than 1%.
I'd say B, less than 1%.
Less than 1%. So meaning that, so if you took 100 people, so said differently, 100 people, if 100 people were going through turbinate reductions, based off of those statistics, anywhere outside of Advent's four walls, 100 of them would be needlessly undergoing general anesthesia to have a procedure done that could and should be performed under local anesthesia. True? True.
Mm-hmm.
Right? Which, and I don't mean, it's hard for me not to, it's hard for these things not to be poignant because these are actually real people going through things, meaning they're dealing with, they can't breathe through their nose. And so, as far as Advent goes, all that we're trying to do is help folks like that who can't breathe through their nose by allowing them access to these simple solutions. That's it. I mean, there's not really a third thing. It's just that. But I go back to, we started on this, why, what led to where we are right now? I'd say that's it. It's just trying to do the best thing for the people that were sitting in front of me. And, what I learned, I'll call it pretty early. I was a pretty early adopter of new technology. And it just so happens the new technology that came out in the ENT space shortly after I opened Advent was revolutionary and groundbreaking. From we talked about in-office CT to balloon sinuplasty to in-office turbinate reduction to, you bang down the list. None of these things existed pre-2004, and they all existed. And I simply, when you're going through residency, you're learning new things and you're constantly just trying to advance your knowledge and your skill set. And I just kept that mindset when it came into practice. And it just so happened the things that came out were like groundbreaking, revolutionary kind of things. And again, I go back to, and so, yeah, why wouldn't I? I'm going to learn how to do it. I'm going to do it. And if it gets me good results, I'm going to do more of that. And what I found, though, is everybody else was sort of ended up bound for some way, meaning they either didn't want to embrace new technology or weren't allowed to, which is actually most of our colleagues are not allowed to do office procedures. Like literally, they are not allowed. Their hospital systems will not allow them to do procedures in the office. Why is that?
I mean, this might spit us down an entirely different rabbit hole, but really it's, if you're a hospital and you have operating rooms, those operating rooms need to be utilized and stay busy in order to drive revenue through the hospital and keep that hospital open and expanding. And so there's zero incentive really to allow a surgeon to do things in their office on a consistent basis if an operating room can be utilized. And that's an uncomfortable truth, but it's a reality. It's just what it is. Now there might be other rationale and reasons and things like that. But, I was thinking as we were talking about turbinates and thinking about how often are turbinates done in isolation in an operating room? Rarely. Usually a septum is paired with that. Why is that? And we can have an entire discussion around that versus in the office here, we can do septum work. We do some, very little, but the reality is oftentimes you don't need to even touch that part of the anatomy, right? So the other thing too that I thought worth mentioning is because you kind of alluded to this, but there was you had to take the leap, meaning you had to be honest with yourself and with Advent about who we are and what are we going to treat and what are we not. And we're not a general ENT practice. And that's a very hard thing for anybody to let go of, especially in private practice, is if you really want to be the top of any certain niche, you got to be all in, and focus on that. And it's a scary place to be because, we train and we have a breadth of training and letting go of some of those skills. Because look, I'm not going to do a great neck dissection because I haven't done one since residency, right? So I know I'm not going to be the best person to be doing that anymore. But the reality is you have to make that leap if you want to excel and be the leader in that and be the best we can be for patients. So,
yeah, no, I agree. I mean, I think I guess on that I'll kind of go down that road, and I don't know if we've talked about this or not. So I will ask a genuine question. Do you know the super secret ingredient that allowed Advent to become Advent? And there's no way you'll know the answer because it's like a guess what I'm thinking kind of a thing. You have any guesses?
Super secret ingredient that allowed Advent to become Advent.
Yeah.
No idea.
It goes in the direction what you just said, which is, what we started as general ENT practice and then we narrowed our focus down. In addition, we started as a general ENT practice that got 100% of our patients as direct referrals. This is and from primary care docs, and so in the early days, this organization was oriented, always towards our patients, but our patients were coming from our referring docs, and we really I still to this day feel like it's important to be the best colleague I can be. There's like the 3 A's, affable, available, and some other A, what I'm saying? But it's just that kind of a thing. But I guess where I'm going though is the actual true super secret, sauce here at Advent is that because Gwen is an audiologist, I would go when I had a chance, I'd go attend her hearing aid meetings. And that's where I basically our meetings generally suck in this regard, meaning our meetings offer zero actual real world help to from a business side or just how can you help more people? Which meaning that from an ENT meeting, I've never learned a thing about how do I expand my reach to people. When I'd go to, meetings with Gwen, audiology conferences and things, a lot of what they talked about was some of these business things that I had no training in this whatsoever. And so it was me picking some of this stuff up, and then like really taking some of those lessons and sort of saying, and we don't currently have audiology, and we don't currently do hearing aids, but we used to back in that era. So she'd take what she learned and applied it appropriately to what she was doing, and then I'd take what I learned and I'd start applying it to this ENT work that we're doing, which basically led me down these roads that we're on, because that led me into there's various steps along this way, but eventually, as an example, through one of those meetings, I came across the book, which is Good to Great, which is obviously it's a great book, very simple concept, and one of the concepts is really what can you be the best in the world at, and what I discovered as I started to think about answers to these questions was back to some of these simple things. Like I'm doing really simple things that make really profound differences. People from early on were coming from far. They'd fly in to Milwaukee, Wisconsin to see me, to have stuff done. And I thought it was like both cool and it's kind of annoying because you shouldn't have to come to Milwaukee to have an office turbinate reduction as a specific, like you should have that available, closer to you. But long story short, I was like, well, if these things that I'm doing and eventually you started doing in this practice, this is this is something that we can be the best in the world at. And humbly speaking, I'd say, and we are the best in the world at offering access to in-office solutions for nose and throat issues. It's not even close. There's no other organization that can stake a claim to the breathing triangle, which is the nose and throat. And so, I didn't have that intention 20 years ago, but I would say the gravitational pull of trying to maximally help those patients in front of me and eventually us is what sort of led us down this road.
Yeah, I mean, that's a good segue to my next question, and probably as we're starting to wrap things up here, but what, and this could be a long end to the question, but where do you see the next 20 years? What does success look like for you 20 years from now?
20 is a long time. Even tomorrow is not granted, or, but anyway, I would say, whatever, 5, 10, 20, same thing. I guess the nice thing for me is I keep it simple and let my purpose be the pull. And so what I just, riffing off of what I just said, so Advent current state, we've got 25 offices in 4 states. We've got, 18 surgeons, 60 medical ENTs. We've got about 330 employees. Great. That's where we are. Where I intend to be and where this organization will be is, we will be everywhere where people need our services. And, that means coast to coast. That means there's a lot of, there are needs out there that aren't going to be met until and unless Advent figures out a way to connect the dots between, these tools and technologies and the people that need them. And so I'd say over the next, I hope it doesn't take 20, and I hope we can get there in more like 5, but we'll see what the truth is. And whatever it takes, by whatever means necessary, that's what we're going to do. And, it's both the nice thing with that, a couple of nice things. One is it's I guess I'd say it seems relatively bold. That's nice, but it's very doable. Meaning like I know, and that, what we do here works. What we do here is actually very reproducible because the elements in it, are, effective. And so, we already know the ingredients that are necessary to be successful in a individual clinic setting. And so now it's just really figuring out, we'll call it the business side of things. How can you scale an organization, which is stuff that can be figured out. So, yeah, I think, and then for me, I'd say I hope to be, I feel like I'm relevant and still making a difference here, and I'm hoping that to be the case as the years kind of keep pulling away underneath our feet. So yeah, I don't know. I think there's a lot of work. There's a lot of work that we've been able to do, and a lot that we've accomplished, and there's a lot more to be done than what we've done. So that's where I'm looking forward to.
Love it. We'll keep you here for now, for sure. So
don't put me out to pasture quite yet.
No,
so,
you'll just have more gray in your beard at that point in time. So
yeah, and maybe I think my hair is going to go backwards. I'm going to do like a Benjamin Button. So I'll have a chia pet hair, because I think I feel like in 5 years or so there's going to be some miraculous invention where you take a pill and then you sprout all this hair.
Man, I've not ever known you with hair, and seen some pictures back when you were in Duke. I'm like, who is this person? So yeah, I'd love to see that.
I once did have hair, but no longer will I. So, but anyway, maybe next time for our next episode, I might either don a toupee or grow some hair. But we'll see.
Good. Well, I certainly appreciate the journey and the discussion around the beginning of Advent and where we're heading. So
cool. Till next time.